Fascia iliaca block can reduce narcotic analgesia, reduce delirium, and it blocks the lumbar plexus. It can be infrainguinal technique, divide anterior superior spine to the pubic tubercle into three parts, or a suprainguinal technique where psoas muscle anterior by concerned by fascia iliaca spread bodily and spread to the nerve. Sci-fi approach below the inguinal ligament but move up to get trap the pelvic articular branches. Volume, it's basically a volume block, 40 ml of 0.1 to 0.2% levobupivacine with epinephrine, 0.1 to 0.2%. When you pushing a needle, first bump is for fascia lata, second bump is fascia iliaca. Nerve is the most lateral structure. It's nerve, artery, vein, and Y of the groin.